Et merci de rester avec nous. Donc, je donne la parole à M. Jean-Paul Jemmy, et coordinateur médical des opérations de Médecins sans frontières. Si vous pouvez être vraiment bref, parce qu'on ne va plus avoir d'interprétation tantôt. Donc, vous avez 5 minutes.
Thank you very much, Madam. Excellencies, distinguished guests, thank you to invite MSF to this symposium. I would like to quickly illustrate the contribution of MSF during the outbreak. We have been present in the area and we have been responding to the outbreak since March, when the onset of the actual epidemics was held. I would like just to remind that beside the cases currently and the epidemics currently ongoing in West Africa, there are still some places like DRC today who have Ebola, different from the actual epidemics, but where we are also involved, and we are also monitoring what's happening today in Uganda with the mayor who have just been alerted with the first cases aligned. Just to say that MSF activities around viral hemorrhagic fever is not only restricted to West Africa and is a global concern, as it was echoed earlier in the discussion. Practically, for the West Africa, we have been working. I will be illustrating in 4 folds what I would like to put. The first one is in case management. The next one will be in training, then lobby, and some of the challenges that we are confronted with. In terms of case management, I think our colleague from WHO portray exactly what's happening in the region. Our contribution to the effort have been, so far, we have been in charge directly of 7 units of Ebola management with a total capacity of 850 beds, with the biggest center today in Monrovia with 200 beds, which is the biggest treatment management unit that we have for Ebola and we ever had in the history. Of those units, we have been, since the beginning, in charge of almost half of all the patients that have been treated for Ebola. We are happy to see that we still only in charge of 50%, where in the early stage we were above 80% responsible. That's clearly sign the fact that all the people come aboard, and the message to the response of that outbreak is all effort and all hands are needed, and we call for more than what have been done so far, and we hope to diminish our contribution as low as possible as long as people will come on board. Definitely, we are not only we can have a direct response to direct people affected by Ebola, but you also have to consider the fact that Ebola disrupts existing health structure, and other diseases who were highly present in the country, I was clearly mentioned early in the symposium, are still striking. For that, we still also have in the focus of our activity an attention to relaunch the health system. If you think about today of country like Liberia or Sierra Leone, health workers have been drastically impacted by the outbreak of Ebola, and as a consequences, health system and health structure have almost collapsed. We do have a concern to step up back the reopening of those structures. We do also have some preventive activities who would try to decrease the burden of disease in the overall population, to decrease the need of that population to go to the health center. Practically, we'll start in the coming weeks, for instance, in Monrovia, mass drugs distribution and treatment for malaria to reduce the burden of disease in the whole city and decrease the need to go to health structures. We also, in preventive mode linked to Ebola, have started launching a distribution that, in collaboration with other partners, on top of the sensitization and awareness that have been raised, we have distributed kits for household with hygiene material and things that people can use to, as much as possible, reduce the contact that they might have with contaminated fluid when they care about their belongings before we transfer them to health structure. So definitely, we are not only focusing on people who are already affected, but we're also focusing on side effect of the outbreak in the environment where we are. For the training, we definitely took as an operational decision and responsibility to spread the know-how of management of Ebola management that we historically had, and for that we have training center and training ongoing at different levels. At international levels, we do have training center today in Amsterdam, here in Brussels, in conjunction with the International Red Cross Federation. We have one in Geneva, where we are training different organizations who are willing to go back and to engage in Ebola fight. We do have, for instance, as an illustration in Brussels, the center today see an average of 350 people a month that are ongoing treatment, that are already trained before being deployed. That includes people that we need for our own response, but also other organization needs to be trained to be deployed later. That is the training bit. We also foster with CDC the opening of an equal center in Atlanta, where also people from America before be deployed can be trained and prepared before deployment. The bedside training is also something that is quite important, and the structure that we have today also serve as a place where people can have mentoring process and coaching before opening the open center by their own. In Donka, Conakry, for instance, are being a place where health workers from Sierra Leone have been trained and coached on how to handle management of Ebola and went back to the country to step up and to have it done. The last fault of what we have been working on is the lobby. Of course, we are being all over the place, and we are being lobbying quite strongly to make sure that the scale first of the outbreak and the epidemic that is ongoing now is really acknowledged, but also that the speed of the response is a bit geared up. We definitely applaud the engagement of the different communities, the US, the EU, and everyone putting resources and commit to put resources to respond to the outbreak, but we still, from a beneficiary viewpoint, saying that from March till now it's a bit too long not to see them deploy. We fully understand that it might take time, but we still have to remember that the pace of the response is still a bit too slow compared to what it might should have been. The last point is a few of the challenges that we are confronted with. Definitely the HR, human resources, MSF alone do have 3,000 health workers in the field on top of the 300 international posts that we have. With the stress and the environment, we don't keep people for the international staff more than 2 months in the field. That implies a huge rotation. So to sustain these kind of numbers of things, it requires a lot of logistics, but a lot of resources are needed. We do have definitely, in line with the roadmap plan for WHO, involve ourselves in a different component of the response, but something will have to be, so a message that has been said earlier and need to be reinforced, and that I would like to echo, is we should avoid to isolate and quarantine the affected country, because it will not help and worsen only worsen the situation of what's happening there. The last bit is definitely the surveillance system in country not yet affected should be geared up, strengthened. Actors and partners are definitely work to make sure that it happens, but it shouldn't. So effort should be continuous and enhanced compared to what is now done. And that's in a short what I would like to share of what we did.